Hello friends and subscribers, a very warm welcome back to Readings in Impact Investing. This is a new podcast hosted by myself, Daniel Rosehill, and the intention here is pretty simple. It's to take interesting material from the world of impact investing and replicate it in audio so that it can reach a wider readership. The website for this podcast is readingsinimpact.org, and you're also able to get it through Google Podcasts, Apple Podcasts, and a bunch of other podcasting apps. So try your app for Readings in Impact Investing, and hopefully it'll show up there if you want to get it. Today I'm going to be reading the first in a series of issue briefs. This one from Social Finance. This one is the introduction to Pay for Success brief 1. This is actually a series of 10 different briefs on Pay for Success. Social Finance is... I'm just going to see what they say about themselves on their website. Here we go. Social Finance is a national non-profit and registered investment advisor. We work with the public, private and social sectors to build innovative partnerships and investors that measurably improve lives. And they have the Social Finance Institute, which shares first-hand learnings and best practices to catalyze social impact in the field. And they also are involved in impact advisory and impact investing. Social Finance is a national non-profit working at the intersection of finance and policy. We are driven by the belief that social and economic systems should enable all people to thrive, and the conviction that we can create the most meaningful and measurable change in the communities when governments and markets work together. We continually challenge ourselves and our partners to use funding and data in innovative ways to achieve the greatest impact. Tracy Palangian, Sir Ronald Cohen, and David Blood founded Social Finance US in Boston in 2011. Today we have more than 120 team members with offices in Austin, Boston, New York, San Francisco, and Washington, D.C. So about the brief series, I'm not going to repeat what Social Finance is for each of these 10 readings. I'm just going to, nor will I repeat the brief about the brief series, but just to say them at the first brief about this issue brief series. This issue brief is the first in a 10-part series written for government officials interested in learning how to use Pay for Success tools and principles. The series summarizes best practices and lessons learned at Social Finance from a decade of designing, launching, and managing Pay for Success projects. It includes guidance on each step of the process, from deciding whether Pay for Success is a good fit to actively managing a project post-launch. So, issue brief 1, Introduction to Pay for Success. Pay for Success, PFS, is a set of innovative outcomes-based financing and funding strategies seeking to directly and measurably improve the lives of people in need. In this brief, we outline how PFS can shift resources towards long-term positive outcomes. The challenge of prevention. Our systems of delivering and paying for services to address social challenges are largely aimed at addressing problems as they arise, rather than preventing them. Based on our work and conversations with policymakers throughout the country, we have observed 4 overarching issues that can help explain this phenomenon. 1 is uncertainty, 2 is the absence of measurement, 3 is reactivity, and underneath these factors, 4 is wrong pocket problems that, in the absence of greater collaboration, frustrate efforts to solve systemic, often dispersed problems. Barrier 1, uncertainty about which programs will achieve policy goals. Many leaders are unsure which programs will achieve their goals. The social sector is flooded with claims of dramatic cost effectiveness of proven programs and of unambiguous success. But underlying these assertions is a large and growing body of research that suggests an unwelcome truth. Social interventions typically don't produce the results they set out to achieve. What works in one place for one group of people may not, indeed often does not, work as well with another. And to back up that assertion that social interventions often don't produce results, there are 2 footnotes for those who want to follow this. It's available as a PDF on their website, 2 PDF documents that people can follow. Barrier 2, the absence of careful measurement of what matters. The public sector is trending toward a greater outcomes orientation, but progress is slow. Though every public agency has planning and budgeting processes, few have clear goal setting, evaluation and reconciliation processes built into their annual cycles. Few follow best practices in setting forward-looking measurement plans with carefully defined targets matched against evaluation methodologies and data sources. And few bring in the voices of community stakeholders and consumers to guide outcome selection. In the absence of specific multi-year outcomes goals and ongoing measurement to understand the extent to which goals are being achieved, it's impossible to create accountability. Barrier 3 is pressure to act to near-term crises. Addressing long-term outcomes involves mobilizing resources today to avoid a crisis in the future. But prevention cuts across the expediency baked into our political process, which prioritizes near-term results that guide annual budgeting cycles. Not surprisingly, myopic measurement leads to more of a focus on resolving immediate challenges and less attention on how to prevent them in the first place. Barrier 4, wrong pockets problems and lack of alignment between sectors. Critical social issues such as ending homelessness or increasing economic mobility don't fit neatly into agency or jurisdictional silos. These multifactorial challenges touch on the work of dozens of agencies spread across cities, counties, states, and the federal government. The advantages of solving these issues are therefore diffuse, and there are few mechanisms available that support benefit sharing between agencies or levels of government. So it can be impossible to realise the activation energy needed to test powerful multi-sectoral programs. PFS in action. This is an example of a paid-for-success intervention happening. South Carolina and Nurse-Family Partnership. In February 2016, the state of South Carolina launched a PFS project that significantly expanded access to the National Nurse-Family Partnership Program, a high-quality nurse home visiting program. Over 4 years, the project is deploying $30 million to serve 3,200 first-time low-income mothers and their babies, with the goal of preventing preterm birth, reducing child hospitalizations and emergency department visits for child injury, increasing healthy birth intervals, and reaching more women in zip codes with the highest concentrations of poverty. The state will make success payments only to the extent that an independent evaluator, JPAL North America, finds improvements in these outcomes that meet pre-specified thresholds measured via a randomized control trial. Mobilizing resources towards outcomes. Jurisdictions throughout the country are beginning to address these barriers through a set of innovative funding strategies collectively known as Pay for Success. PFS strategies build stronger contractual relationships between funding and results, paying for important policy-relevant outcomes achieved rather than uncertain programs. At times, PFS strategies leverage private investors to support the working capital needs of programs by providing them with expansion capital to serve more people and taking on the risk and potential reward of getting better results. A brief overview of how Pay for Success works. Number 1, identify goals. Social service funders such as health and human service agencies or local workforce boards identify specific high-value policy goals. For example, lowering preterm birth rates for first-time mothers. Assign measurable outcomes and prices. Social service funders decide in advance how to measure progress by selecting a clear set of outcomes and defining an evaluation methodology to track impact. They also agree on what degree of improvement on those outcomes would constitute success and put a price tag on the value of each outcome goal achieved. Step 3 is embed outcomes into contracts. Funders enter into outcomes-based contracts with social service providers in which payments are only made to the extent that outcomes goals are achieved. Step 4 is mobilizing capital. Where necessary, community organizations can draw on upfront working capital for projects from impact investors, a growing group of foundations, mission-driven financial institutions, high-net-worth individuals, and others who care about the social impact of their investments. Since funders only pay for results, PFS can help figure out what works in a given place and time, ensuring that limited dollars are used effectively. And that actually wraps up the first of the brief series about Pay for Success. And just to give the acknowledgements, this issue brief series was made possible with funding from the Robert Wood Johnson Foundation as part of their work to promote cross-sector alignment to better address the goals and needs of peoples and communities. This brief was written by Jack Seagal, Vice President of Advisory Services, and Emily McKelvey, Associate Director, with support from Rachel Levy. Social Finance is a national non-profit organisation dedicated to mobilising capital to drive social progress. I hope this provided a helpful introduction to Pay for Success for anybody listening, and if you'd like to continue receiving more episodes about readings of important material in the world of impact investing, please consider subscribing to this podcast.